ziua, suntem la Offline Med News. Astăzi vorbim despre suportul Fondului ONU pentru Populație în elaborarea, promovarea planurilor naționale de screening de col uterin. Invitatul meu este reprezentantul Fondului ONU pentru Populație, Ian McFarlane. Bine ați venit, domnule McFarlane.
Thank you very much. Good morning.
Pentru început vreau să reamintim publicului nostru despre faptul că sistemul de sănătate din Republica Moldova se bucură de asistența UNFPA în baza planurilor anuale și de acțiuni pe țară între anii 2015-2017, acum, chiar în acești ani. Care sunt planurile care derulează la acest moment?
UNFPA's mission, which is something that we have in all countries around the world, is the same as the one that we have here in Moldova, which is agreed with the government. Basically, our role is to make sure that every pregnancy is wanted, that every birth is safe, and that all young people can fulfill their potential. In practical terms, in the health sector, our work is to make sure that the government has the technical capacity that it needs to deliver on certain key priorities. For example, cervical cancer. For example, in making sure of universal access to contraceptives, that it has the right policies in place, and that it is responsive to the needs of the population. We work also, very importantly, with the ministry and other partners in terms of the health of young people. Young people are 25% of the population in Moldova. They're critical for their future. And it's a great privilege, actually, for us as UNFPA to work with young people themselves to try to help them have better health.
Și totuși, care sunt programele? Exact, care sunt programele doar pentru sistemul de sănătate care derulează acum?
So, some examples, some specific examples of what we do. Last year in 2014, we helped the ministry and other partners evaluate their national strategy on reproductive health. We were able to bring technical advice to help them understand how well they'd done and to understand what they need to do in the future. UNFPA work with other partners to train school health nurses so that they can, in turn, talk to children, talk to young people professionally and appropriately about what they need to know in terms of their health. UNFPA worked with civil society partners to reach out to marginalized groups, people who are living with HIV, people who are not able to access the services that they should. We help train doctors and nurses respond better to cases of violence against women. We have helped, particularly, I like this very much, we've helped also the system of supply for contraceptives by integrating that into the national data management system.
Pentru că suntem acum în Săptămâna Europeană a Cancerului de col uterin, sigur că vom vorbi despre suportul UNFPA în elaborarea planului național pentru screeningul de cancer de col uterin. Dar ziceam că anterior acestui plan, UNFPA a contribuit la realizarea raportului privind situația pe țară în sistemul de sănătate pentru sau capacitățile de executare a acestui screening. Care a fost rolul UNFPA în acest sens?
We have a facilitating role. Our role is to bring to Moldova the expertise and experiences of other countries. So, for example, we were able to bring several different experts to help Moldova professionals themselves understand what it was that they needed here in Moldova. Secondly, we also helped Moldovan professionals go outside of Moldova. Currently, there's a health professional who is in Italy, understanding better some of the technical aspects related to the cervical cancer program. We also took a team to Ireland. Ireland has a very advanced screening program for cervical cancer, and colleagues were able to understand how a system works in another country and then see how they could adapt that to the needs in Moldova.
Câte misiuni de acest gen au fost pe parcursul anului 2014?
In 2014, we just had the one main, if I remember correctly, the one main mission to Ireland. Right now we have one in Italy. We're working very closely with the Embassy of Italy and also the Embassy of the United Kingdom to see what possibilities we can have in 2015 for continuing to build the capacities of health professionals.
De obicei, cine sunt specialiștii care pleacă și fac acest schimb de experiență cu partenerii din alte state?
One of the things that's very important in responding to cervical cancer is that it involves a range of different stakeholders in the system. So, of course, it's led by the ministry as the main actor in response in the country. But there are also different institutions who play different roles. There's a role for the National Health Insurance Company, for example. There's a role for the Institute of Oncology. There's a role for primary healthcare providers. In the chain of things that need to happen for an effective response to cervical cancer, there are different stages. And what we've tried to do through the stakeholder consultation that you mentioned and the report that was developed is understand precisely where the gaps are in that chain. There is a gap in terms of an effective screening program. There is a gap in terms of the technical knowledge in colposcopy. There are gaps in terms of how effectively to monitor the progress of a patient. All of those different elements and those different partners form the whole of a system that needs to be strengthened. So in consultation with those different partners, we then identify where are the logical next steps to build the capacity.
Am înțeles acum care sunt partenerii naționali, dar care sunt partenerii internaționali în elaborarea, mai bine zis, în implementarea acestui program, acestui deziderat pentru sănătatea reproductivă de Republica Moldova?
The main partner that UNFPA works with in Moldova, but also in the region as a whole, is the European Cervical Cancer Association. And they are extremely knowledgeable and professional and understand how countries have made progress, both countries like Moldova, but also countries that have got more advanced programs in Western Europe, for example. They're our main partner and they provide support to UNFPA in the region as a whole, including in Moldova. We're also exploring now creating greater connections with institutions in some of the countries that I mentioned. In the United Kingdom, they have some very advanced associations that have practiced and prepared training modules. We would like in 2015 to consolidate that. Likewise, in Italy, there are a number of institutions that are doing that work in their own country but have expertise that they want to share. So part of our role is really mobilizing new partnerships to help the national authorities here. Moldova is also part of, I think of this as a peer group, a peer support group. Moldova is part of what's called the Black Sea Coalition. The Black Sea Coalition on breast and cervical cancer, although we're working mainly on cervical cancer. And that group includes countries in the Caucasus like Azerbaijan, Armenia, Georgia. It includes Turkey. It includes Ukraine, Moldova, Bulgaria, Romania. The important point is there that professionals from these countries meet periodically to exchange how they're making progress. And so Moldovan professionals can learn from the experience of Georgian professionals or Turkish professionals or Bulgarian. We haven't yet said why it is so important that this work continues. I think we should recognize that Moldova as a country in the last couple of years has really taken this issue much more seriously, which is very good. But we still have a situation where up to 3 women every week die. And we can talk about technical assistance and we can talk about trips to other countries. The heart of the matter is it's unacceptable that we as health professionals are living in a country where something which is absolutely preventable, this is not something that is a complicated disease that needs to be, this is preventable. So I think while talking about the ways in which we can help as UNFPA, I think it's incumbent upon health professionals themselves to really work harder together to make the system work. I don't think in 2 years' time, we really do hope that Moldova will be able to say, yes, we've done something, and no, there are not women dying in our country from something which, as a modern country, a middle-income country, you should be able to prevent.
Ați vorbit despre faptul că Republica Moldova din 2009 este parte a coaliției bazinului Mării Negre pentru prevenirea cancerului de col uterin și cancerului mamar. De altfel, tot cu suportul UNFPA ați reamintit, deci Republica Moldova este parte a acestei coaliții, dar este parte și a Asociației Europene de Combatere a Cancerului de col uterin. Ați spus și despre importanța aflării Republicii Moldova în această coaliție. Și pe ce loc totuși se poziționează la moment Republica Moldova între cele 8 țări ale coaliției bazinului Mării Negre? Cum mergem? Care sunt pașii de dezvoltare? Cât de bine ne dezvoltăm comparativ cu partenerii noștri? Pentru că majoritatea dintre cei care fac parte din această coaliție sunt țări din fostul spațiu sovietic.
I think that there's no league table, right? That in different areas, different countries are making more progress than others, and some are behind other countries. I think that in terms of the way in which Moldova did the analysis by itself and took the time to think through what its response should be is indeed a good practice. And that practice was shared at the last meeting of the Black Sea Coalition as a good example of how you can bring the different partners together, how you can look at the steps that are needed in the process, and how you can decide what it is that your actions will be. So that was a good practice compared with the other countries. Other countries have perhaps made a bit more progress in other areas. And for example, I think that from a technical perspective, the way that the Turkish system works, they have managed to put in place a very effective screening program. Georgia has been amazing at raising awareness among the public. So different countries are making progress in different areas, and what's really valuable is Moldova can see how another country has done one thing, and they can take that and use it to improve themselves. I think we're at a very important point in Moldova because the action plan is there. The commitment is there. We're beginning to see the capacities required to be put in place. And I think the next stage, this is Cervical Cancer Prevention Week. It's about raising awareness. What we need to do is be confident that we have the system in place that can respond properly to the needs of women. We're not quite there yet. So we need to speed up on that. We need to be confident that what we can offer as a health system is not going to do harm, but is going to do good. That we have the registry, that we have the knowledge of how to carry out the screening, that we have the system that analyzes the results of the screening, and the feedback is there all the time to the client, then we need to also raise awareness among the population that these services are of good quality and that they should go.
Credeți că decidenții din sistemul de sănătate din Republica Moldova înțeleg pe deplin importanța implementării screeningului național de col uterin?
I think that it's clear from the actions that we have seen this week, led by the Ministry of Health, that there is a renewed commitment in the ministry, in the Institute of Oncology, in the National Health Insurance Company. There is an understanding that this is something that is very serious and that they want to address. And I think that should be we should congratulate the leaders for that. A country always faces many choices about where it invests. A country with a new government has to develop a program and think about how they allocate the resources. I would argue that if this country wants to progress, then the political class, as well as the government and the technical staff, need to be able to invest better, particularly in health and particularly in education. I think they're the priorities. I don't know, and it would be very good for you and other people in the media to ask the government leaders, the members of parliament, if they think they're doing enough to prevent 3 women dying every week. I think it would be important to ask that question. And it's important to keep the issue alive. People should know that this is something that the government is working to respond to. There's another aspect to this which is broader than just cervical cancer, if I may, but it's connected. One of the debates that you hear in the country is the debates about the number of people. We're always talking about the population is going down, the population is getting older, the population is leaving. One thing that's very interesting is that just in terms of numbers, the fertility rate in Moldova is declining, which means that women are having fewer children on average. Moldova has the second highest rate in the world of secondary infertility. There's only one other country in the entire world that has a higher rate of secondary infertility. Secondary infertility means that a woman has already had a child, would like to have another child, but cannot have another child for medical reasons.
For medical
For
reasons.
medical reasons. It's not to do with
For
economics, social. It is, they are trying to have children, they want to have children, and for some reason they're unable to do so. What we know is the link between sexually transmitted infections, infections like cervical cancer, have a major impact on fertility.
Yes.
So, if we can reduce sexually transmitted infections, which Moldova has the second highest rate in the European region among people aged 15 to 24. It's not great. More efforts need to be made there. If we can reduce sexually transmitted infections, if we can have an effective program that stops cervical cancer, the likelihood is that actually women will be able to have the number of children that they want to have. So this cervical cancer work is very important as part of a bigger picture about the rights of women to have the number of children that they would like to have. And I think that is a message that everybody in the country, not just the medical professionals, but also the political leaders, need to understand. Coming back to your question, do they know? You, we, many people have a role in making sure that they understand the evidence, the facts, the medical dimensions, so that we can respond in a human way to the needs of those women.
Interesantă incursiune. Iată, eu nu știam despre faptul că suntem pe locul 2 în acest top neplăcut de infertilitate, practic pentru al doilea copil. Revenim totuși la tema noastră și vreau să vă întreb, care este instituția cea mai importantă pentru implementarea screeningului de col uterin în Republica Moldova?
I think that there's no question that the Ministry of Health is the overall institution charged by law to make sure that the citizens of this country receive the health treatment and prevention that they need. So it's clear that it falls within overall leadership of the Ministry of Health, and I think the Ministry of Health is doing a fantastic job at doing that leading. I think it's a mistake to think that there's only one institution, one person, or one part of the health system that is the most important. I think the doctor who meets the client is very, very important at the primary healthcare level. I think the technician who understands in the Institute of Oncology what the implications are of diagnosis is very important. I think the communications officer for the Ministry of Health who helps get the message out is very important. I think the person who is the accountant. I think the person who is sitting in the secretariat of this national steering committee, who happens to be sitting in a unit in the National Health Insurance Company, is very important. We can't do this thinking only in terms of one institution or another institution. And what has been most encouraging for me in the last couple of years is that those actors involved have moved beyond this idea that it's we're in charge or they're in charge. We've moved to a place where we understand as a team. All our institutions have a vital role, and if we're going to challenge the tragedy of 3 women dying every week, we've got to do this together. Institute of Oncology has a vital role in addressing this problem, no question. It can't do it by itself. We need to have the people who are at the front line, if you like, who are in the localities, who are meeting the women who come. We need them to be involved too. It doesn't mean that they're more important than the institute. It's not about who's the most important. It's about a response from professionals to a serious problem in our country. And as I said, there are many different actors. I think that all of those actors it's great that they're realizing that they are part of a joint response to address a serious problem. There are very few problems in any sphere, but also in the medical sphere, where it just relies on one institute or one person. And cervical cancer is a good example of where you can't make progress if you don't collaborate. And I think the good news is, here in Moldova, we're seeing more and more of that collaboration, and all of those institutions and people that you mentioned should be congratulated for that, and we should keep encouraging them to work in that way.
În afară de colaborare, ce condiții mai trebuie să întrunim noi în sistemul de sănătate pentru ca să avem un screening național de cancer de col uterin calitativ?
In terms of a quality screening program, there are various elements to it. There's the way in which women are treated when they first approach a health facility. How they're cancelled, how they're given information, how they understand what it is that's going to happen. Right? So they have a clear sense, first and foremost, they have a clear sense of, okay, this is the process, this is the procedure, so they know. That's a very important part of any quality system. Secondly, you need the technical skills and knowledge of the professionals involved in doing the actual screening. They need to know how to carry out the screening. They need to know how to protect the sample that is taken. They need to know where they have to send that sample. They need technical capacity in the analysis of the samples that are taken. We need a data system that tracks the progress and responds to an individual client. These are some of the aspects of a quality screening program. The heart of it is seeing the woman who comes for the screening as the center of what is done. So it's constantly responding, keeping her informed. One of the things that we know, which I think is an indicator that there's more quality to look for, is that the majority of screenings in Moldova that do take place in the third or fourth trimester, quarter, i.e. very late. Now, in a quality program, in programs like the programs they have in Sweden or in other European countries or in Ireland, the diagnosis is done much, much earlier. And that means that the chances, if there is a negative, the chances are being able to treat that cancer are much, much greater. So I see quality as meaning we're able to respond sooner to the needs of the person, as well as to do so in a very professional, technical manner. So of course, a quality system also includes the diagnostic equipment, those sorts of dimensions. But I think the greatest element of quality program is being able to respond throughout the process to the client.
Deci, cel mai mare și cel mai important lucru este să răspundem necesităților populației feminine, dacă vorbim acum de cancerul de col uterin. Vreau să vă întreb, suntem deja după un an de implementare a Planului Național de Screening de col uterin. Care sunt cele mai importante lucruri realizate din punctul dumneavoastră de vedere?
I think the main achievement so far has been a very, very thorough understanding in Moldova among all the different actors involved of what practically needs to be done. We have a ministerial order that sets out a national plan. That was achieved in 2014, last year. Clearly in 2015 that has to continue. What continues in parallel to the implementation of that plan is boosting the capacity and knowledge of the health professionals involved and making sure we track the progress that is being made. So I think the big achievement was this coming together of different institutions, different parts of the system, figuring out what it was that was needed. And now we have to make sure that those actions are indeed implemented.
În 2015 mai avem încă obiectivele de implementare a planurilor educaționale pentru studenții de la universitate și de la colegii, dar și pentru practicieni. Mai avem încă implementarea procedurilor operaționale. Ce mai este încă de făcut în 2015?
Well, I can only speak really in terms of what UNFPA plans to do. I think that you will hear from others that there's a terrific amount of work and effort from many different actors involved in this. So I think the education aspect is very important. We, as I say, our primary role is not financial. We don't have a budget to pay for this. This is a national budget, national responsibility. Our role will be in 2015 to harness best practice from different parts of the globe, particularly in Europe, and see how we can enhance the capacity of those people at the different levels to be able to respond effectively as part of a team.
Și pe final vreau să vă întreb cum credeți, când veți considera încheiată misiunea UNFPA pentru Programul Național de Screening de Col Uterin în Republica Moldova?
I don't think in terms actually of UNFPA's presence. What's most important is that what we relate to, which is the International Conference on Population and Development, that's the framework which gives action to countries and to UNFPA as an agency to support countries. The ICPD agenda says what we should do as countries. And Moldova is part of that. And Moldova has established its own priorities. And we've talked this morning about the critical priority of addressing cervical cancer. I mentioned at the beginning that we have helped the country think about the evaluation of its reproductive health strategy and what they should be doing in the future. Time, for me, is related to achieving the national goals related to women's rights, sexual reproductive health rights, and that could be carried forward by UNFPA. It could be carried forward by civil society. It should really be carried forward by all of us as individual health professionals, as advocates, as politicians. So the question, how long UNFPA, is not the question to ask. I think the question to ask is how soon do we as a country, as individuals, as health professionals, how soon can we say with pride that we indeed do have an effective health system, that the rights of women in terms of health are fully respected, that I'm a proud doctor who's making a difference in the lives of people who are part of my country. I think that's the question to ask.
Și dacă spuneți că întrebarea trebuie schimbată în sensul ăsta, ce ați dori femeilor din Republica Moldova?
Of course, I wish, as I think most people would do, and women themselves in Moldova would wish to have a healthy future. And I wish that they not only have a healthy future, but they fulfill their potential as individual human beings, that they can make the choices that they want to make. Not that they have choices imposed, they have their own choices. That they have, therefore, the ability to fulfill their rights, to enjoy their health, to be part of a family or partnership. And I think that is something that this symbol that you have here of knowledge, I think is a wonderful expression, if you like, of that hope. That not just UNFPA, but yourselves, the health system, the health professionals, I think we all share that hope for better health, for fewer deaths related to cervical cancer, and for a system that is really responsive to women's needs.
Vă mulțumim pentru că ați fost astăzi la noi la Offline Med News și pentru faptul că ați susținut dorința sau voința, mai bine zis, a medicilor, a lucrătorilor medicali pentru a aduce calitatea serviciului medical și în mod special a screeningului de col uterin pentru femeile din Moldova, care au nevoie să fie sănătoase și astfel să fie și frumoase.
Mulțumesc!
Vă mulțumim că ați fost la Offline Med News și vă așteptăm data viitoare tot aici, cu un nou invitat.